I just felt that people just ticking boxes and not exactly listening. They asked the name, date of birth, medication, and all that kind of thing. Is the patient breathing? Sometimes they were more worried about, have you got a dog or any animals, get them out of the room. I had to keep repeating myself the whole time. When I spoke to somebody else, then spoke to the next person, just constantly going over and over and over. And I just felt that they were listening to me, but they weren't hearing me correctly.
Understanding the caller and realising what it's like for them is crucial.
They're very, very good at keeping one calm, if that's what... They're good at doing that, and they're just constantly asking questions so that you haven't got time to get wound up. But it's really hard because you've got this person next to you that's almost, seriously ill, and I'm trying to keep that person calm. But I appreciate it's hard for them on the other end of the phone because I don't know who they're speaking to. But I just feel that they should listen more.
The carer, in most situations, knows more about the situation than what the patient does. And obviously in my case, me being an alcoholic and most of the time drunk when I was being ill, Alison knew what state of mind I was probably going to be in.
Clive and Alison's most successful interactions with the service are those typified by empathy.
I know that some of these places that they go into when they're alcoholics or drug addicts, it is a mess and stuff. But they've still got to realise that that person's ill and somebody's called an ambulance for them. First and foremost, listen to whoever called the ambulance service. Listen to the person in charge, i.e. the carer. If they do that, they'll then get more respect themselves.
It's about that sensitivity, that willingness to stretch out, that willingness to take into account the person's circumstances, to address that, to acknowledge it, and to be encouraging and warm to them.
Another key tool for practitioners is cultural sensitivity.
I think being culturally aware is vitally important. I think if you don't understand the culture, there's room, as within any culture, for a lot of misconceptions.
We're not just dealing with a medical condition, we're dealing with a person, a human being. And it might be that actually they're not in a position to tell you what they wish, and they may lack the capacity, but it's our responsibility as clinicians to understand what they might want to happen to them. And partly that's about engaging with the community and understanding whether they have particular needs.
Taking some time to develop an understanding of the local communities may be very valuable, particularly regarding issues relating to end-of-life care.
I think for a paramedic on the ground who's dealing with the Sikh community, who's required to attend or visit a Sikh home, it's important that he should recognise that within our community we have sensitivities around gender. For example, a female being handled by a male. There's also a very sensitive approach around Orthodox Sikhs who may wear the traditional symbols of Sikhism, such as a turban, and it's important that they know that, for example, you don't shave someone's hair without actually getting their consent. So little things like that actually makes the service much more sensitive, much more responsive.
It's all right to ask questions. They need to be asking them, well, look, what would be the best for you? Is there a particular way that I could be helping you that would be easier for you to deal with?
I wouldn't be offended with you saying, so for example, can I ask you this question? Because I would feel that we feel wanted. You're making the time and effort to ask us these questions because you're looking after our needs.
The expectation isn't that there needs to be a sort of a full understanding. The expectation is there needs to be sensitivity. So for the Sikhs it's very important. It adds that little value to the service if they perceive that the individual is attempting to understand them.
This new dialogue can present great opportunities for clinicians.
Opens up the possibility of a kind of dyadic relationship that two partners, where one, although is in possession of technical craft, is in service to the other. So in some ways, the person who's from the diverse background also has a kind of right to inform the process, say, well, this is what works for me.
Valuing the differences in the cultures and the differences in individuals, whatever their circumstances might be, can only enrich what they're doing.
Equality and diversity to me means about treating individuals as individuals and understanding their needs slightly wider afield than their clinical needs. And how I bring equality and diversity into everything I do is just taking that ethos with me on each and every patient I look after.
All of us have a role to play in ensuring equality of access to the services that C can provide.
Healthcare in the NHS is about bringing the best for the most, not the very best to just a few. So we have to help understand the needs of patients and make sure we're setting up our systems to deliver the right care.
It involves thinking about how people access services, what they get when they access services, and what the outcome of what they get does on their lives.
When I go to my GP, sometimes I find it difficult to express what I want. We need to remember what it's like to be on the receiving end of care. We should be aiming towards partnership care and not just an autonomous clinician deciding what's best in complete isolation to the needs of an individual.
If you engage and involve the user, you are helping the user to own that service.
Everybody is different. If you do your best to find out what those differences are and develop your treatment in relationship to those differences as well as the actual medical condition, then your patient is going to be far happier than if you just go straight in and do things. It may take a little bit longer, but in the end it means the outcome is going to be more effective.